Everyone, thanks for joining us for this edition of Health and Family. Today we turn our attention to the problem of asthma in our community. We hope to find out all we can about this dreaded disease. Helping us to do so today is nurse Tracy Nash, the very knowledgeable nurse from Open Airways, where their slogan is Helping Bermuda Breathe. We welcome Nurse Nash to Health and Family. Welcome.
Welcome. Good morning, Dawn.
Good morning. How are you today?
I am fine, thank you.
Good, good. So we always like to start off with defining what we're talking about. So what exactly is asthma?
Right. So asthma is basically, it's a chronic inflammatory condition that affects our small airways. So the small airways that are in our lungs, those are the ones that are generally affected by it. And we like to think that somebody with asthma has got what we call sensitive airways. Okay. And those sensitive airways react to a variety of different triggers. And that sets up the process of asthma. And I think if I can use my props, I can kind of show you a little bit better. This is basically what a normal airway should look like. Nice and clear inside, and the muscle fibers that wrap around each of the airways should be relaxed. And you can see that it's easy for air to pass through that airway. However, with asthma, we get this process where that sensitive airway reacts to a variety of different triggers, and you get inflammation, and that's the really important bit, inside the lining of the airway. So it gets thickened, it gets inflamed, it gets red. You get extra mucus produced, and then the muscle fibers that wrap around the airway, they tighten up. So now I think like the wheeze that sometimes you hear, or the doctor will hear, is the air struggling to get through that narrowed airway. Okay. Often people with asthma, they're coughing because they're trying to get rid of this extra mucus that's being produced. That's the body's natural response, is to cough. And the chest feels tight, and it's hard to breathe because those muscles have tightened up.
You bring up an interesting question. It wasn't actually on my question list, but could this contribute to like high blood pressure because it's all squeezing together, or is that something totally different?
It's something completely different, yes.
Okay.
Yes.
So let me go back to my script. Do we have any stats regarding asthma as far as how many people have asthma on the island?
Yeah, we do have pretty good stats actually, and we estimate it's about 1 in 5 school children, and we have an asthma register in the school, so we've got pretty good information that it's about 1 in 5 school children. 1 in 10 adults is the estimate, which is just over 8,000 people in Bermuda. Wow. And those rates are higher than the UK or the US. They're, in the children, they're basically double what you would get in the UK or the US. So we do have a big problem with asthma here in Bermuda. Okay,
so that was my next question. So who's more prone to get it, children or adults?
Right. So typically asthma starts in childhood. And typically it would start in a child who's got a family history of asthma. They may have some signs of eczema as a baby, they may have some food allergies, and that's maybe a sign that those are the children that will actually have asthma. But sometimes, for reasons we don't really know, the asthma may go away during teenage years and may come back again in adult years.
That's what I wondered.
So sometimes an adult will truly get asthma for the first time as an adult. Sometimes it's a recurrence of asthma that they had as a child that they've kind of forgotten about. So it typically starts in childhood, but does start any time. It can start in adulthood. Certainly it can be triggered by somebody's occupation. So again, that would be a reason for it to start in adulthood.
So those were some high stats you just mentioned. Is it related to the weather or climate?
It's a combination of things. So it's definitely, there's a hereditary genetic link. And in Bermuda, it's often quite hard to find families where you don't have allergies and asthma, and allergies and asthma are obviously linked. So a child is more likely to have asthma if they've got a strong family history. But then we've also got an environment that triggers asthma attacks or asthma flare-ups. So with our humid climate, we have mold, we have dust mites, and those are things that actually sort of exacerbate the asthma. So I think those sort of combinations.
So that mold is a biggie.
It is a biggie in Bermuda, yes.
Biggie. So in doing my research, I noticed that a lot of women here locally are getting asthma, and I was just wondering why? What was the reason behind that?
Yeah, it's hard, and we don't really know why certain people get asthma in adulthood. As I say, it typically starts in childhood, but when it does start in adulthood, it does seem to affect women more often, and we don't really know why. So, I mean, there's still more research needs to be done. And sometimes, unfortunately, when it does start in adulthood, it can actually be worse, the asthma, for some reason as well. So it can be more of a problem for those people, especially women, when it starts later in life.
Yeah. So I think you already answered this, but as far as like today, we see more cases. Is it attributed to the environment? Is that making the asthma cases increase?
That's an interesting question, because there was an increase in asthma, probably around the 70s going onwards. We're not entirely sure. There's quite a few different theories, and probably a mixture of all of them contains some of the truth. Certainly, it's better diagnosed now.
Yeah.
So that's definitely one thing, that GPs recognize and diagnose asthma better than they used to. But there's also a few theories around. One of them is that basically our modern way of living. We live in now houses that are sort of well sealed. We have well sealed windows, well sealed doors. And because of crime, we close up our houses during the day. We leave them closed up. Maybe because of air conditioning, we've got them closed. And we're not getting that airflow and that ventilation that we used to get. And so we're setting up an environment indoors where we're maybe contributing to asthma triggers. There's some other theories as well about sort of air pollution. Is it to do with the amount of air pollution, cars, different things are around? And then there's also an interesting theory about, are we almost too clean? So basically our immune system, which is developing in our first few years of life, is generally triggered by getting colds and infections. But now if we're keeping everything so clean and we don't have the major infections that we used to have, the immune system basically doesn't have enough work to do. And so it starts to react to different things like allergens, which really should not be, harmful to the body, but it reacts to them to say, so again, we're not entirely sure what, but it's probably a combination of all those different theories.
The reason why I asked, that some people have said like moving to a different climate, and one of the climates that come to mind is Arizona, because it's quote unquote dry out there. Does that make a difference?
It's a difficult one again, because there's pros and cons to all sorts of different climates. A cold, dry climate will definitely trigger asthma, so people who are exposed to definitely cold air have to be very careful. But humid air also contributes to asthma symptoms. So again, it's that difficult balance. Bermuda, obviously where we have a lot of humidity, that contributes to dust mites and mold in particular. Somewhere in Arizona, they might get a lot of pollen at certain times of the year. So somewhere that's mild may get more pollen issues as well. So it's a real balance. The main thing with any climate is if you've got your asthma well controlled through your asthma treatment, your medications, then you can cope with whatever climate you're within. So the really big sort of message is that asthma needs to be controlled.
All right, well, you have your meds out here. Why don't we start talking about what's what and how to use it and so forth?
Right.
Okay, go ahead.
Yeah, so going back to our airway, where these muscle fibers have tightened up, the inhalers a lot of people are very familiar with, which is our Ventolin or Airemir, which is our blue, usually blue, they're the rescue relief inhalers. They only work on those muscle fibers. And they relax those muscle fibers. And yes, it feels great, because all of a sudden you get that relief that you can get more air into your airways. However, they're not doing anything with what's going on inside the airway. They're not treating what's happening and what's causing the asthma. And so this is where we get basically our steroid medications, which is a natural steroid that's produced in the body, and those are the anti-inflammatory. So generally this is the Flixotide and the Becotide QVAR. They are going to deal with what's going on inside the airway, treat that inflammation and that mucus, and get the airway looking more open and things.
So the bright colored ones, the orange in them.
And then what we also have is what we call our combinations. So basically these ones, Dulera, Advair and Symbicort, have a combination of the single prevention with a long-acting relief.
So those are popular, obviously.
So these are very popular because a lot of people find it easier just to take one inhaler. It's easier to take. Studies have shown that it's more effective when they're used together. So the combinations are a great way to go.
Okay. And then this is a space, life space. Explain that for us.
Right. So basically, there's a lot of different types of inhalers, lots of different ways, and so it is really important that if anybody is on their asthma treatment, that they know how to use them.
Okay.
So it's always good to get a review. If you're using basically what we call the metered dose inhaler, which is any of these types, it should be used with a spacer.
All the time? Or
All the time.
Okay.
All the time to basically get the full amount of medication down into your lungs where you need it. Basically, these devices are just to make it easier.
Okay.
To get the medication down. You can use it without.
Because I'm thinking, I've seen people just do that.
Yes, you do.
Yeah.
However, you're not getting as much medication in the lungs where it needs to be.
All right.
So
that makes sense.
recommendation is to use. And so this is why Open Airways is around, because this can be very confusing for people. There's a lot of different things. So we're here to answer questions, to give advice, and to help people through and make sure they know how to use the different devices.
Okay, so like the Symbicort and the other ones, if we're using that should be sufficient for the day.
So yes, so basically these are daily prevention treatments. So yeah, you would usually use them most times prescribed in the morning and the evening, and that should be enough to control your asthma. Occasionally, if you have a flare-up from a variety of different reasons as a trigger, then you might need to use a Ventolin in between, or depending on what treatment program you're on, you might use more Symbicort. Again, it depends on what you're prescribed. But if you are well controlled, the aim is that you actually don't need to use the relief inhalers because you've got good control. Good control means having no asthma attacks. It means not having to use the blue inhaler. It means not waking up with asthma. It means being able to participate in any sports, any activities. So that's what our aim is, to have good control.
All right, well, we're going to take a break, but I wanted us to think about the different types of asthma that exist, and if there's any way to prevent asthma in the beginning, right, from the get-go. So let's take a break. We'll be right back.
All right, thank you.
All righty, we're going to take a stay tuned. Nurse Nash from Open Airways is joining us, and our topic is learning how to adjust to having asthma. We'll be right back.
Healthy people and healthy communities.
It's back to school time again, so make sure my asthma is under control. Review inhalers and discuss an asthma action plan with my doctor. Start me on a Preventer inhaler daily. Don't wait until I have an attack. Send a rescue inhaler with me to school. Remind me to avoid triggers like dust and mold. And inform the school nurse about my condition.
A message from the Department of Health.
And we thank you for rejoining us. Nurse Nash from Open Airways is rejoining us. And our topic is learning to adjust to having asthma. So we took a little break, and then one of our producers wanted to know, well, what happened 60, 70 years ago? I'm sure people had asthma then. What happened? How did they deal with it without the meds?
Well, they did, and they didn't deal with it very well because we didn't have good medications. And some of the medications that we did have were very strong with lots of side effects. But fortunately, there was less asthma around then. But yeah, no, people struggled until we got onto these, good medications. So it was a struggle, and there was a lot of maybe home remedies and different inhalational things and Linctuses and different things. But it was a struggle.
Yeah. So we wanted to ask a question about the different types of asthma. Talk to us about that, if mild to extreme.
Well, there's different levels of asthma. I mean, one of the things about asthma is it's variable. But there's also different types of asthma in the terms of, there's childhood asthma, adult onset asthma, there's occupational asthma. Obviously, certain professions have a higher risk of getting asthma. And then there's also, you can clarify asthma as whether it's allergic or non-allergic. And one of the great things actually about the research that's being done at the moment is looking at these different types of asthma and actually hoping to maybe target the treatment more effectively to the type of asthma that you have, because not everybody has the same asthma. And so that's a sort of exciting area that maybe we'll get more targeted treatment to the type of asthma that somebody has.
That's why it's important to go to a doctor to get prescribed, and that you shouldn't be sharing.
To have a review, yes.
Yeah, every so often. How often? Like every year?
It's definitely recommended every year that somebody should visit their GP for their asthma review.
Okay.
We hope that they'd get an action plan, which they would, so the GP would actually list for them what they should be doing
Right.
when their asthma is good, what they should do if their asthma gets worse, and certainly what they should do if they need to go to the emergency room if their asthma
Right.
gets very bad. So people need to know this because they're at home with their asthma. You know,
I don't think a lot of people knew that they were supposed to get it checked every year. I think the medicines that they've been prescribed, they take for many, many years. And maybe if it gets worse, then they'll say, oh, okay. But I think for the most part, people just...
Generally, yeah, no, we recommend everybody gets checked, you know,
Okay.
reviewed once a year.
No, I agree
Asthma
with you,
does
yeah.
vary,
Yeah.
and
So we were talking about children, and I've seen children with asthma. Do they eventually outgrow it, or how does that work?
it's an interesting subject. Some children do seem to outgrow it when they're in their teenage years. It's almost like the body's got enough going on when they're a teenager, and the asthma sort of takes a back seat. Sometimes, though, it does come back. And later on in life, and sometimes even though those children seem to have outgrown it in teenage years, if they get a cold, they may still get their asthma, or
Right.
if something else may still trigger their asthma. So even though they maybe think they're got it under control, you know, you're never too sure. So they should always still carry their relief, their rescue inhalers with them, because you just never know if something is going to actually suddenly trigger an asthma attack.
So you mentioned earlier that asthma is it sort of related to allergies, to having allergies?
It is, yeah.
All right. So go ahead.
Sorry, yeah, I was going to say, so basically, I mean, allergies affects the whole body.
Right.
So for people who just have the nasal allergies, they breathe in and they maybe get the sinus, nasal allergies, hay fever, it's called all sorts of different things.
Mm-hmm.
So some people will just get that, but others, as the air travels on down into their airways and their lungs, they get the asthma. So most people with asthma will also have nasal problems.
All right.
So the majority of people with asthma do have allergies, and they will also probably get nasal, sinus, hay fever issues as well.
And you were actually telling me the correct way to deal with, in addition to taking this, because
Right.
it's all related, right?
It's all related. So generally, as well as dealing with the inhalers, often you need to deal with the nose and take in medication for the nose. And so basically, you can take antihistamines. There's a variety of different ones. Claritin and Benadryl were the sort of Benadryl and Piriton were the original antihistamines, but they can make people sleepy. There is a newer generation of Claritin and Zyrtec which tend not to make people drowsy, and so they can be used. But what's really good for nasal symptoms is the nasal sprays.
Okay.
But the important thing is that it's the prescription nasal sprays that you get from your GP,
Not the
because
one-
there are some over-the-counter
Right.
ones that can actually make things a lot worse.
Yeah,
So it's making sure you're taking the right prescription nasal spray and also knowing how to use it and taking it properly as well. So again, those are things that we can help out with at Open
Okay.
Airways.
Would you be, this is off, but would you be able to just sort of demonstrate just a little bit as far as not swallowing the medicine?
Right.
Because then you're making
So,
it worse
yeah,
for yourself.
A lot of people say, oh, I don't like nasal sprays. They taste horrible.
Right.
Well, if you're tasting it in your throat, you haven't taken it properly.
Okay.
So the idea would be, and I don't have some of my inhalers, but to actually, usually you have to shake them, lean forward and put in the nozzle of the inhaler in the nose, but to the side. So you're pointing out sort of towards the ear and squirting, and you can give a little wiggle if you want, and a slight sniff, a small sniff, but you don't want to take a great big sniff, snort, and
Okay.
feel it in your throat. And then you would repeat on the other side. So with the head forward at about 45 degrees, and then the nose will do its job by taking the medication through into all the sinuses and where it needs to work.
Okay, I'm going to try it. All right, so let's talk about exercising, because some say, yes, go for it, do your exercising, that helps. And then some say that your asthma symptoms will only get worse. Which
Right.
one is it?
We say absolutely everybody with asthma should be able to exercise.
Okay.
Exercise is, we want well-controlled asthma. So if you've got well-controlled asthma, you should be able to exercise. And a lot of Olympic athletes have asthma.
Okay.
So, you know,
They can do it.
yeah, exercise-induced asthma, which is a sort of thing that some people think that they have because they need to take their inhalers when they're exercising, is generally uncontrolled asthma. It's just asthma where they're not well controlled, and so when they exercise, it flares their symptoms up. True exercise-induced asthma does occur, but it generally occurs in elite athletes who are doing excessive amounts of exercise, and they're breathing in very hard, and that's often maybe what's triggering their sort of exercise-induced asthma. But for most people, they should be able to exercise as long as they've got their asthma well controlled, which is taking their daily prevention.
In the beginning.
In the beginning.
And usually that's in the morning most times.
Mornings and evenings,
Okay.
generally, yeah.
All right. Should a pregnant person, if they're supposed to be taking asthma medicine, should they be doing that?
Yes, a pregnant person should definitely continue their inhalers. It's really important because actually having an asthma attack when you're pregnant is not a good picture. And interestingly, when women get pregnant, about a third of them, their asthma will actually get worse. 1/3, their asthma will stay the same, and 1/3 of them, their asthma will get better. But we don't know which one it's going to be, and you don't know, but it is important to continue taking the asthma medications when you're pregnant.
So you're definitely a proponent of the medicines. Can one get addicted to the medicines?
No, and
Okay.
beliefs like that are what sometimes prevent people from actually using the
Right.
medications. Basically, if somebody's well controlled, they shouldn't need to use their relief or rescue inhalers very often.
Okay.
Where sometimes people feel that they get this dependency is because they're not taking the prevention. They're puffing on their blue inhalers every day, sometimes more than several times a day, and so they may feel that they're dependent on them, and that's actually can be quite dangerous, because somebody who's just using their blue inhaler all the time, they actually can be training their asthma to be worse. And it's going back to those airways,
Right.
where you open up those airways with the blue inhaler, but it only lasts for 4 hours, so then it tightens up again if you haven't dealt with what's going on inside the airway. And so you end up getting this sort of process where you're actually training the airway to be more twitchy by constantly opening and closing those airways, those muscles.
Right.
So definitely not a good thing to be using the Ventolin or the blue inhalers all the time.
Right, you'd rather us use
Absolutely,
the
we need to be,
Symbicons and all that. Alrighty, so if one doesn't experience asthma attacks, because I do hear of people having asthma attacks where they really can't get any breath, should they still continue? I mean, I'm just playing devil's advocate right now.
Yeah, so basically we have to assess sort of asthma control. And so one of the ways that we do that is with sort of these sort of questions that we have on one of our Is Your Asthma Well Controlled leaflet. So we're asking somebody, how many times do they actually get asthma? Is it more than twice a week? So are they using their inhaler just more than twice a week?
Okay.
Do they wake up at night with their asthma? Are they getting asthma symptoms more than twice a week? If the answer is yes to more than twice a week, they should be on prevention.
Okay.
So basically we think that's not controlled. If somebody is generally just having very, very occasional symptoms of asthma, then absolutely it's fine maybe just to use the relief just very occasionally. But generally most people are often using it sometimes more. And so it's kind of working out where you are and deciding what's the right treatment level for you. And that's one of the things that we like to do when we visit with people, that we'll sit down and we'll talk through so that somebody understands their asthma. Now, if somebody's really good for a long time, they may be able to reduce some of their prevention and see how they do, but know that if things start to get worse again, how to adapt it. So it's all about understanding your asthma and being able to adapt the treatments if you need to.
Alrighty, so I'm I understand the medicines, but are there any like home remedies for asthma?
There's complementary therapies, I would say.
So take the medicines and
So
then...
take the medicines, and then obviously having a good diet in lots of fruit and vegetables, which has got higher antioxidant properties. Exercising as well is good, and swimming is a great exercise for people with asthma. Playing a wind instrument for a child, I mean, get them using their lungs. Certain breathing exercises can be beneficial. So there are some things that are sort of complementary, but we would always say that they're add-ons to your asthma treatment.
So that's priority. You need to take your meds.
Take your meds, and then you can complement it with good lifestyle choices.
So as you get older, does the asthma, if you have it under control, you should be okay.
You should be okay.
But if you don't, it can get really...
If you don't have your asthma well controlled through, you can actually set yourself up for problems later in life. Basically, asthma is what we call reversible. However, if you don't treat it,
So
and
reversible meaning...
in that you can actually change, you open this, dilate this up, and you can clear up this inflammation. So you can actually get the situation looking good. If you don't deal with any of this and you leave things worse, you can actually get permanent changes in the airways, which is a lot harder to deal with. Also, if you're a smoker. I mean, if you have somebody who's got asthma and you're smoking as well, you're setting yourself up for potentially a lot more problems later on in life.
Smoking is a no-no.
Yes.
On so many occasions.
Yeah.
Alrighty, so we're about to actually conclude. Is there anything else you want to tell us, do's and don'ts, about asthma? This is it. Sell it.
Well, I think, the thing is just know your own asthma. So get education, ask questions, understand your own asthma so you can deal with it and you can actually, manage it, because you're the one who's got to manage it at home. You might see your doctor or something, once a year. The rest of the time you're at home dealing with your asthma. So get as much information as you can so that you can manage it.
And then you guys normally come to the schools on a yearly basis?
There's a school program where children are taught about asthma. We actually, as Open Airways, we do home visits. We will go out and visit people in their home, which is great because we can actually give them advice about their environment as well as the asthma medication. So we can kind of look and see if people are using air fresheners or different things that might actually be making their asthma worse. So we can look at that. But sometimes, we'll meet somebody in a workplace, but we're there to answer questions. So I guess I'd like to say people can find us on openairways.com and they can like us on Facebook at Open Airways Bermuda.
Yeah, and we mentioned through earlier on about the perfumes and things of that nature. And I used to be a huge perfume wearer, and now I don't wear them at all, period. Even on my off days, I just figured.
Yeah, I think we have to be aware that those strong perfumes, strong chemicals can be real irritants and can be triggers for people with asthma. So now we should have workplaces, schools, hospitals that all should be perfume free.
Okay, and the insect sprays and all that.
Yeah, absolutely. Stay away from all those harsh chemicals.
All right, thank you so much.
You are so welcome.
Oh, we want to thank you for joining us and giving us the vital information on this topic. It is unfortunate that some of us will contract asthma in our lifetime. Hopefully, with careful study, we can minimize the effects that asthma can have on some of us by listening and following some simple strategies to cope with this ailment. A big thanks to Nurse Tracy Nash for sharing her expertise with us on asthma. On behalf of the team, I'm Shay Burgess. Thanks for joining us.